Okay, welcome everybody to the Valley Care Wellness podcast. It is the official third podcast here, and I'm here with the owner of Valley Care Wellness, Yuri Langle.
Yeah.
Say hello.
Hello guys. Thank you.
So thank everybody for joining us. We're going to be talking about some wellness, some natural healing, some cool stuff like we always do. Yuri, you have a special guest today. Could you please introduce us to your special guest?
Yes, of course. Today we have Catherine Warnock. She's from here, and she has her own clinic of the facilitating the psilocybin in here in a clinic way, and it's a pretty good. So I met her not a long time ago, and I said it's perfect to talk about. So,
okay,
can you introduce yourself and tell us a little bit about you?
Well, first of all, I just want to thank you very much for having me. This is very special. I think the work you're doing here in town is remarkable, and it's amazing. And I think we're lucky to have you here. I want to just say that first.
Thank you.
So my name is Catherine Warnock. I own Mariposa Counseling Center here in town, and I am a counselor. I'm actually a licensed professional counselor. I've been doing that for, I guess, almost 9-10 years now.
Okay.
And I offer psilocybin-assisted therapy.
Yes.
Wow. Very, very interesting. And so I came in on the conversation with that. It sounds like a very fruitful conversation. And psilocybin therapy, as I was hearing earlier, it was a very controversial thing, And when I first started getting into it back in the early 2000s, when I got out of the military, it was like super controversial. But even at that time, they were like, hey, there's potentially happening with addiction, addiction therapy, PTSD therapy. Is that the kind of stuff that you deal with in your clinic?
Absolutely. So I'm trauma informed. And I've pretty much found that most every issue is related to a trauma, whether it's depression, anxiety, grief, relationship issues, addiction, all of those things. So yeah, and something else I just want to point out, because I think this is pretty magnificent and it's worth noting. New Mexico is trailblazing in this arena. Last year, the governor signed a bill that's allowing psilocybin-assisted therapy to be, the rules and regulations are currently being worked out right now. And hopefully by the end of the year, we will have it available. Available, and will be the third state that has brought it on. It's exciting.
So exciting.
Wow. So we're kind of like on the forefront of the legislation as far as that's concerned. What other state? I think Oregon does it, right? Or
Oregon was the first. Colorado was the second.
Oh, wow.
Interestingly enough, New Jersey is the fourth.
Wow. Yeah, that's right. I think it's kind of following along around the medical cannabis, right?
Yes, I think that's the only way we're going to get it normalized or standardized is through the medical model. You got to get it in there one way, and then I think that should open it up for all the ways.
All the ways.
Yes, ceremonial included.
And so Yuri, you offer some similar modalities here. You guys do natural healing treatments involving with those types of medicines. How do you incorporate what she does, Catherine does, into what you're doing here at Valley Care Wellness?
Well, this is pretty similar, but even in this trying to heal different kind of healings, medical or how I do is more holistic, I'm going one by one too as well, and I'm in informed trauma. So the most important is to identify the trauma they come, and then we can just go through what is the right way to facilitate the medicine with them. Of course, I do in a more ceremonial ritual way, more spiritual. And she does total medical that we was talking together about. We need to learn
from each other.
From each other.
So it sounds like what you do is you kind of have like your intake process, and you see where your clients are at here, and then you determine what path you want to go down depending on their unique situation, right? And I know there's different types of earth medicines and stuff you go down. Is psilocybin something that you explore here at Valley Care Wellness? And I know you don't do anything here at the store locally. You kind of you kind of outsource it with other resources in the community. But is there a way that you go about determining if someone's going to be a psilocybin candidate, maybe an ayahuasca candidate? Is what goes on with that?
Exactly, because it's different levels of trauma.
So
not
trauma.
everybody comes with the same problem. So, but the most of the people with just psilocybin, for me, I think I see the best results for right now. When we comes with something more deeper and a problem, those traumas are really, really hard for some people, ex-militaries, people like that. I recommend ayahuasca
Yeah, first
But-
responders, veterans.
And it's anyway, the medicine is not for everybody though. So you have to be clean. You have to have a diet before the facilitation and be prepared, mental and physical, everything.
Yeah, so let's get that out the way right away. Like, if you're going to be doing any kind of this stuff, we're always recommending that, detoxing. It's going to be something with intent. This is a very responsible, professional environment. We're here to actually heal people naturally, help you discover yourself so you can actually live a more fruitful life. It's not something that you want to come, not partying here. We're not partying here. And I think, Catherine, as you as a medical professional, you're taking that same position. But so I want to kind of ask you the same question that I asked Yuri. Like, so if you got an intake, you've got a patient, is it the depth of the therapy going to be based on their trauma, or do you only offer psilocybin, or is it going to be, if they say they're dealing with an intense trauma, is it going to be more medicine and then more therapy on top of that, or how do you deal with something like that?
Yeah, and everybody is different. I want to make that really clear. So what I do is I also do an assessment. I do, there are some people that are just contraindicated if they're taking certain medications, if they've got certain conditions, for example, severe cardiovascular issues. Yeah, that's not a good combination.
Yeah, right.
So, it's really important that you that assessment be done, because we don't want to give medicine to somebody that puts them in danger. That's kind of the opposite of what we're doing here. But I also do assess, because not everybody is a candidate for it, and some people aren't ready. They think they want it, but they haven't done enough work to really have the experience that they're seeking. What I do, because I do follow a medical clinical model, I follow like the research model. If they're wanting or they need something more ceremonial, much more spiritual, maybe they're coming to me because they're having like an existential crisis with their maker. I work with trauma and I'm working more clinical. That would be a situation where I might refer to Yuri, because you're going to be a much better suited to handle something like that than I am. So and here's something I want to say, because it's really important. I believe this medicine should be used in all ways, not just one way. I don't think the medical model or just the ceremonial, not one way is going to work for everybody.
Yeah.
Everybody's different. And so there is a vetting process that I think is really important.
Wow, so this is really fast. I didn't know I was really getting into it. But this is just like the breakthrough stuff for treatment. Because I know last time I realized, I researched the topic, the success rate for addiction therapy was pretty high with this kind of stuff, right? Can you either of you speak to that?
Yeah, I don't have actual numbers, but it's extremely high.
Right? That's what I remember hearing.
Yeah, because I do know this much. I think the numbers, this much I do know. About 80% or more of addiction is caused by trauma.
Of course. That makes total sense.
So, and this modality helps resolve trauma. So, yeah, it's getting to the core so that they don't need the, whatever it is, fill in the blank, heroin, alcohol, whatever the addiction.
And the addiction tell us what is the trauma come from.
Yes. Yes. It helps.
Normally.
Yes.
That's happened.
Yeah.
Okay, so I'm so fascinated by this, because people still think of, shroom, psilocybin as like this taboo party drug, you go rave and stuff. But here you girls are telling me, like, we're taking patients in that have been through so much stuff. Who knows what they've been through. And it heals. It's healed you guys. It's done a lot of wonders for me as well. And it's the opposite of what society thinks. So, that being said, what would you say to anybody out there? And we'll start with Yuri on this one. What would you say to somebody out there that's like, hey, you're just hippies, man, and you guys are just doing drugs. Like, why are you doing this?
Well, first of all, the intentions and the medicine. Well, these persons don't understand how medicine work, how the medicine communicate with you, and with the intention of healing. So yeah, if you just doing it for recreational, of course it's gonna be just experience, and that's it. You're not gonna get anything else. And if you're doing them often, the medicine take over of you, right? And then that comes with an addiction, no matter what is the substance. But when you do it in the right way, with like saying preparation, 101 first before the ceremony, and then during the ceremony, all the attention, and after, continue with another integration of this information. And where we put our attention and what we do is the way what we do is what we got in a result as well. So for me, these people's talking about, oh, this is drugs, what are you doing? I don't mind, man, because they don't even know what is this medicine or how it's communicate, or even the capacity, the potential of healing, and they're just doing it for nothing. So it's basically everybody can think whatever they think about the medicines, but when you are in this path and you grow on this way to not only, we study, I have certifications and everything to say, hey, even, brain, neurals, everything moves. It's so much the only experience. It's so much happening in your brain, opening another perspectives. You never see your life again the same way. You would change totally. So the integration is really important because that's the way how we're gonna start a new life with new habits, with a good intentions in life, and start feeling of love, gratitude, accepting, forgiveness, all these lives and the conscience is important, part of our mind, because we are humans. And that's why we come from here.
So that's really intense because, Catherine, I doubt that when you get clients, they're not having that mentality like this is just drugs. They're coming at you and they're hurting. They're probably desperate when they come to you, right?
Well, and a lot of them have already done the research.
I
They
bet.
already are going, they've tried everything. They've tried everything and it's not working. And then they hear about, oh, wait, I've been hearing this. There's some research out there. And so here's what I will tell you. If somebody comes to my door and they're like, hey, I just want to try out this psilocybin thing. I'm like, yeah, that's not what I do. That's not what,
That's cool. That's
sorry.
cool of you.
No, this isn't this. And in fact, if you go to my website,
Which is what?
mariposacounselingcenter.com,
There you go.
mariposacounselingcenter.com,
There you go.
you won't even see it on my first page.
Wow.
That's not I'm not just giving people this medicine. It's like on my third or fourth page.
Do you need it? Are you a
Yes,
qualified
right.
candidate? Right.
Exactly. And so when people show up and they're just like, hey, I want to try this, it's like, well, that's not really how I work. It's more about the very first question I ask people when they show up is, what are you hoping to address?
Yeah, yes.
And if they say, oh, I've suffered with depression all my life, okay, let's talk. Let's see if this is right for you. One thing I did want to say, kind of back up what you were saying, is this whole, I've had a lot of people come to me who have used mushrooms before in their early years, when they're younger, or, when they were hanging out with friends one day. But then when they use it medicinally, they're shocked. They can't even believe. They're like, I had no idea this would do that. I'm like, yes, it's because when you do it in a therapeutic process in a very intentional way, it's almost as though the medicine unlocks new levels. It's almost like if you show up with reverence, with intention, with honor to the medicine, it's like the medicine opens up new levels that allows you to access healing that you can't really access when you're hanging around a bonfire with your friends. It's a different experience. And I've had multiple people say to me afterwards, I will never use it recreationally again.
Yeah.
I did not understand how I was discounting. I also have a lot of people that when I tell them what I do, they're like, oh yeah, I know mushrooms. And I'm like, do you really know what the mushroom? They're like, yeah, I've done it before and it was amazing. And I'm like, okay, well, so you had an experience and that was probably amazing, but I don't think you really understand the depths unless you've done it this way.
This way, yeah.
So I find this very intriguing because it seems really intense to, if you're going to be doing a psilocybin with somebody and they're going to be like basically spilling their soul, opening their heart, they're going to trauma dump on you while they're in this state of mind. I mean, so it sounds like you guys are like shamans in a way, right? Because you're there with them as they're going through that journey, right? I imagine there's a lot of crying. Is that something you experience, Catherine?
A lot of emotion. Yeah.
Yeah.
In fact, I believe that's a big part of what psilocybin does. Is it finds those pockets of hidden emotion and it surfaces them so that they have to be processed and dealt with and faced. It's almost like, in fact, people who microdose sometimes, and I know we haven't really talked much about microdosing, but they'll take very small amounts and they'll immediately say, I'm just like an emotional mess. And I said, yes, because microdosing is about bringing the stuff up so you can work through it. It's bringing the hidden out into the open so that you can actually have access to it and process through it. But yes, there's a lot of emotion.
And Yuri, how do you deal with that? If you're dealing with the patient, if they're doing one of these natural medicine modalities, is that similar where you're kind of going through the journey with them and they're opening up to you? Are you with them in that same situation? Kind of, is that how you approach things, or is it different?
Well, yeah, I mean, you're just guiding, protecting, making a safe place.
Wow.
You know, clean the area. You just provide confidence to this soul in that process.
Wow.
And be there supporting. But the most of the time is just your presence. When you have confidence and you know how the medicine does the work in the soul, you know, and you respect that, the medicine it will work with you. So it's a lot of emotions, a lot of questions, you know, integrate with the person. But yeah, I do one-on-ones. And of course, whatever they need water, you know, go to the restroom, it's everything. You are there with them all the time. So
that's a lot of trust. So these people are coming with you, their hearts and their spirits are open, and they're obviously trusting basically their life with you. Because I feel like if you're not with, and I've always believed this with this type of therapy, like if your shaman, if their spirit isn't strong and if they're not prepared to go through that journey with you, you can go down a dark path. You can go down a wrong path. So I think it's very commendable for you two to have the confidence and the spirit and the experience to guide these people who need this type of guidance, right?
Yes.
And so, you know, thank you for doing that for the community. I think this is a very wonderful thing that you both are doing for the community. Obviously, I'm not a big fan of hardcore Western medicine. It's let me down in the past. I've talked about it on the podcast before. So hearing about you guys doing these alternative methods, and it's backed by science. Yeah. It's not like it's just, you know.
Well, and another piece that I think is really critical, at least for me and the way I do it, is I actually require prep work. Like, I mean, like at least 3 sessions where I am developing a relationship with you.
There you go.
Because I don't expect you to go into this vulnerable state, spill your soul and guts. If you don't feel like you can trust me, then I've got you, right? Like I'm going to be there. Whatever comes up, I'm going to be ready and prepared to deal with. So I think that's also, and then integration, I also require that they actually already purchase integration, because I don't want anybody going through the experience and going, I'm good. That's it. No, integration is critical.
Integration, how do you mean by that?
Integration is, okay, you have these huge insights, these huge connections in your brain. You know, you've created new pathways from the neuroplasticity.
Yes.
How do I apply this new understanding to this life that I've been living?
Literally integrating it into your lifestyle, into your being.
How am I going to...
This 3D dimension.
Yes. How do I take this unbelievable, amazing information that I gained about myself and the world, and now how do I apply it to my life that is, you know, kind of compartmentalized? Yeah. And how do I make all that match for permanence, right? So that it lasts. It's not just, this is something I've seen on these documentaries where people go to, you know, other countries to get this work done. A lot of the tribes, like I'll just say, for example, Maria Sabina's tribe, they do amazing work in Oaxaca. But here's the thing, integration happens in their community. That they're set up to have integration. They come back to the United States. We're not set up here. We don't have that in our culture.
No.
So you have to be intentional about integration, because a lot of these cultures that have been using this medicine for tens of thousands of years, their whole culture is set up for prep and integration. It's all part of it. It's not just this.
Yeah.
It's not just the medicine, the experience itself. But here's what happens. Westerners go and they just do this.
Yes.
And then they come back and they're just like confused and they're distressed, right? Because they're not doing the whole thing. And so that's the reason, which I know we'll get to it eventually, that's the reason for my documentary and the book, is that I want to show people you need the whole package. It's not just just sitting with the medicine.
Yeah, unfortunately, people, life is very multi-nuanced. It's not black and white. There's a lot of variables, and incorporating it into your lifestyle is really where the work is being done, the everyday practice, the everyday work. And then, Yuri, I think you were going to say something as well, going in onto the integrations that Catherine was
Yeah, the
talking about.
integration, man, is the most important. So for me, it's like before you get prepared, before the ceremony, prepare like mental, what are going to be your intentions. Of course, we already studied your traumas and everything. And then we're going through the ceremony, is the night, it's simple. And then after, I do after 2 weeks. After 2 weeks, because in the first week, everything is still pretty nice. The medicine is still in you, and you're still really soft and lovely. And the second week, the medicine is almost gone. And then you start feeling this sensation of, don't go anywhere, I want you. And it's the medicine reset you, mental, emotional, physical, everything, reset and connect neurons that never used before. So empty you, kind of, because you're releasing traumas and releasing emotions and releasing. So our container got empty. And the integration is to fill it up, that with all this love, understanding, positive affirmations, meditation, breath work. Yeah, new beliefs, actually. Yeah. But now as an adult, you will choose whatever resonates with you. And that makes you happy and fulfill. But the integration, like we talk about, you were saying, is the translate. For me, the job is translate from the information from another dimensions to this one, 3D, so you can receive all these new habits or new everything that you got, but in this 3D. Like, how am I gonna get abundance? How I feel abundance? Because a lot of people talk about manifestation, the law of attraction and everything, and it's okay. And you can pray every day for that. But if you don't feel it, you're never gonna manifest it.
You don't align with it.
And it's a way to talk with this universe, right? With this spiritual side, and you will attract everything what you want to this life, even just to be calm.
Yeah, his life is it's so difficult. We keep talking about Western society and Westerners, and it's like we have been conditioned for a long time since I was born to rely on Western medicine, to develop negative coping mechanisms. We're going out there to go drink or go do drugs recreationally or get into another toxic relationship. So it's actually encouraged in our culture. It seems like to do the wrong thing. It's actually very difficult. And that's why I'm so honored to be here with you guys, because you girls, that are offering the community positive coping mechanisms with trauma. Because I think you were saying earlier that most of your clients 80% have trauma, right? Yeah. And so that's just life. We've all got to go through these types of tests, and if you don't have someone there because a lot of people don't have good family, they don't have a good father, a good mother, a good brother, a good sister, they don't have anyone to turn to with this stuff. And so what you girls are doing is like, hey, you can come to us. And this is how we healed ourselves. And this is how we could potentially heal you. Right. And so, I want to kind of go back to your the microdosing, because that's a big topic. Because I've got a lot of friends that engage in it and stuff. Mm-hmm. What are your feelings on the microdosing? And then Yuri, I'd like to answer you that question too.
So I think microdosing has its place. I will say that just kind of because I do base a lot of what I do on science, the science shows that microdosing is no better than placebo.
Wow.
Yeah, but I think the reason that it shows
crazy.
that, I think it's crazy and the reason it's crazy is because I think the studies didn't do any coaching or therapy or work with it. They're just taking the medicine and then living their life. Mm-hmm. So here's the thing. You don't need a coaching. You don't need a therapist to microdose, but you should be doing some work.
Yeah.
A workbook, journaling, examining yourself, setting goals, trying to work on things, right? You have to do something with it. It's not just a magic pill that if you just take it, it's just, for some people it is. I can't say that. Some people just microdose and
gets them through it, huh?
Especially if they're super depressed. It lifts. It provides a lift.
Right.
But here's the thing, to really work through and get permanent change, you got to do some work with it. So I think microdosing is amazing. It's done wonders for myself, for many of my clients. The one thing I love microdosing for is people weaning off of pharmaceuticals. Because when you're weaning off these pharmaceuticals, there's all these withdrawal symptoms. It's a nightmare for people. And I have found that microdosing can mitigate some of those effects and make it a little easier to wean off of these meds. So.
Yeah, I'm so glad that you said that, because I feel like I've had a lot of friends that engage in microdosing, and it felt like something was missing, because I've talked to Yuri about this. I have a lot of respect for psychedelics. I mean, whatever you want to talk about, psilocybin, ayahuasca, all of it, I treat it with the utmost respect, because I've seen it heal people. It's a big deal.
Yes.
So when I say people engaging in this microdosing and they weren't doing the work, I subconsciously I saw that. I'm like, you guys aren't doing the work. And I didn't see them improving, really. So everything you're saying makes perfect sense to me. Yuri, what's your position on? I'm not judging you. If you like microdosing, that's okay. I'm just wondering.
Man, so that's the beauty of the podcast and they explain all this, because I don't agree that much, with the microdose in any substance. But where I go with that is, so medicines, all the plants. It could be plants, it could be from the animals or whatever. It's the medicine comes from the Mother Earth. And each medicine has a different spirit. The spirit has a different energy, and they work with different traumas. And this is nothing new. This is nothing new. This has been for ancients, and it's books and movies and schools, actually, like for herbs and stuff. They heal people, and it's a way. So if you microdose any kind of medicine, what you're doing is putting the spirit inside of you, but in a little bit. So it will control your emotion, but not releasing, but it controlling for 5 hours, 7 hours. So that's why you microdose, and of course, the society put microdoses so we can do it a little bit every day. But for me, when you do something a little bit every day, so you become that medicine, okay? And I don't want to be any kind of medicine, because I respect that I don't do it that often. When I'm sick, I go and use the medicine in the right way, where it's a hard dose and a ceremonial I'm going to release a specific trauma or release everything I have to release, And with addiction, it's pretty important. I like it. They microdose to release these addictions with the hard drugs, and it's hard. And I know it works, like microdose for those kind of people, because it's too hard just to do it at once. They don't even able to do it. So it's a good point, what I say. But it will, for me, has to be supervised for somebody to say, okay, stop. Now you can leave that process and then come back to the, probably doing one ceremony to see your results, and then continue. We'll see if you still need it every day. But the deal in here is to be free, right. Because when you have in this elixir of this medicine of fully love, in the end, you don't feel any necessity. That's the goal. When you just need water, some breath, but you don't need nothing, and when you are fully complete, perfect as you are. But the microdose, what I see, and I would like to mention about that, different medicines work. For example, I see in here for the Santa Maria, called the cannabis, Santa Maria. So they use a lot for just live every day, smoke the Santa Maria. And the same happens. You are abusing of this medicine, the medicine take over of you, and then you become to be this plant now and take over of your life, because we are gods. And that's why we need to just focus. But you use the medicine as therapy and a ceremonial with the process like we talk about, and supposed to you leave it. It was a month, you will still good. But it's some traumas, level 3, level 4, they need some microdose. Yes.
And I have a couple of things I want to say that follow up with you. So first of all, I agree that it should never be every day. I think microdosing, you need I usually either do every 3 days or 4 days on, 3 days off, but it should never be every day. Secondly, I agree. You shouldn't be dependent on it, right?
Yeah.
There should not be a dependence. In fact, microdosing, if you're really using it in the way that I think it's best used, it's a temporary thing. It's maybe 4 or 6 weeks on, a month off, and then maybe another run. Maybe, but maybe not. The only time I microdose is I do it by intuition. I can feel when I need it. So I didn't really discuss this yet, but I was on pharmaceuticals for 30 years. I was able to get off of them with psilocybin.
Well, like benzodiazepines or something like that? Do you mind me asking?
No, it was antidepressants. It was Wellbutrin.
SSRIs?
Yes, SSRIs. Wellbutrin is an MA, anyway.
MAO inhibitor, right?
I think, and then Effexor was an SSRI, and I was on the.
Those are hardcore.
Yeah, no, I know. They're Effexor especially. Like getting off that is.
No, they're super.
Gives you brain zaps for months.
I know a lot of people who weren't able to successfully get off of them.
Right, who can't, right? And so getting off of so now I know that I will microdose, but it's intuitive, and it's definitely not every day. And it's definitely only to help me work through things. Because one thing I also think I mentioned earlier, sometimes microdosing is absolutely the wrong thing for somebody because it's going to make them more anxious. Because a macrodose is going to bring all your stuff up in front of your face and basically make you deal with it.
See, I like that.
Yeah. Whereas a microdose is like, oh, here's a little bit, but it's going to bring up feelings and it can make you more anxious. Because and that's not helpful, right?
I feel like microdosing is kind of like an homage or like an adage of the Western medicine, where it's like a pill.
I agree with you.
A pill's gonna save my life, and it's, once I do this, because that's the guys I knew that were doing. They were treating it like that. Well, I'm microdosing now, so now I'm Superman, and I'm like, I think you're trying to take a shortcut.
Yes,
you know?
I agree.
Exactly.
I agree. I think it is kind of a shortcut.
But I see what you're saying though. When you have intent and you're more intuitive, and you're like, hey, I might need a couple of days on here, to kind of even myself out a bit.
Just to deal with some stuff.
I can understand. I smoke weed, so I get it. I don't smoke all day, every day, but sometimes I like to smoke before I eat, relax when I'm going on a hike or something.
Humans, we need it. All the humans has addictions, like coffee, a bunch of things.
It's tough.
But, what we can do, more conscious, we can pick the best addictions, That's the good thing. And then when you need it. With balance.
It's so true. I'm not arguing. I'm laughing because it's true.
It's natural though, but it's with balance. So you have, like she's saying, you're focusing in yourself. You are study, you got in a course, or you're playing music, get into something. Not only to go to work, sleep, go to work, sleep, and the microdose. No, that's not a job. You need to grow. You need to be better, have results on yourself.
Right, and microdosing shouldn't be taken as, I'm going to take this so it can do something for me.
No.
You should be taking it going, let me allow this to help me channel and flow and figure out what I need to work on.
So I can work on myself better.
It's like a tool that will help amplify so that you can get to the internal, but you should be taking it going, well, I'm just going to take it and just let it do its thing. It's not going to do anything. That's not how it works.
And there's the intentions, even the intentions for the daily things, for your water, for your food.
Yes,
if you're going to smoke, intention da Santa Maria. If you're going to get the microdose of psilocybin, intention that microdose every morning and say, please, thank you, be grateful, and then take it. It will do it for you. It is proof. The person works in the water, and has the different forms, and so you drink it, and it has the different results on you, and it's the same water, but it's with the intention of abundance, health, and of course, life change. So the intentions, it will come like the power of the God that we have. So intention, everything.
So I like where this conversation is going. And I think it only makes sense that you two beautiful souls are hanging out here on this podcast because if you hadn't paid attention, people listening and here, Catherine and Yuri, alcohol consumption is down like billions of dollars.
Yeah.
People are just not living like that anymore. They're not going to the bars. They're not partying like that. I think people are really thirsty for this type of culture and lifestyle. So I think, like I said, I think it's not ironic. It's not a coincidence that we're all here hanging out because this is where everybody's going. You know,
well, alcohol is so toxic. It's toxic to your body, to your mind, to your soul. And I think now with repeated generations, current generations are seeing it and going, "This is not good." Isn't that cool? Us. Mm-hmm. It's so amazing. Yeah, and here, let me tell you something. I used to love a nice glass of red wine. Me
too.
Loved it. I got to say, with psilocybin, I can't really tolerate alcohol much anymore. It's like I've even tried like smelling, going, oh yeah, and then as soon as it's like, no. There's just something about, especially with alcohol, mushrooms do not like alcohol. And a lot of people that have come to me for depression, anxiety, grief, shame, guilt, self-esteem, all the things,
right?
They usually will report afterwards, oh, weird. I notice I'm not drinking anymore. I'm like, oh, is that weird? Is it really weird? No, I think that's actually in alignment with what's best for you.
That's right. It causes a lot of anxiety. It's a depressant. And I'm not trying to, hey, if you drink out there, that's cool. More power to you. I'm just stating that myself and the society in general, especially here in America, we have gotten far away from that. It's not at all the way it used to be just 10 years ago, right? And then to have Yuri open up this wellness center and then have you have your clinic, I think that speaks to that. I think that the bars are losing the business and then you girls are getting the new business, which is hard to say it's a business because it's really a practice, really. I mean, you're really servicing the community in a much larger way than any bar could ever do it, you know? Yeah. But so, yeah, and you know, we all do have our...
Let me mention something about the alcohol. So for me, alcohol is another substance that helps, it has their good things because we could be natural, but at the most of the time, you know, in the bar or whatever, in excess, it's not really good. Activate your nervous system levels, incredible levels that you can even having a panic attack or getting under pressure. That's why the people start listening to the music and they start crying. You know? And because it's all the emotions is coming out. Yeah. And you say, I'm getting, this party is so good. And then in the end of the night, everybody's crying, with everybody, hugging everybody. Like, oh, I love you guys, I love you. Like, because they know working in themselves. The wine, the glass of wine, or a couple beers, I don't know, whatever, with balance should be some assistance to just relax, relax and go to sleep or go relax. But you know, in the end, is the way how to do it. Even if I got that glass, I will say, okay, thank you. The intention, my wine, and put it, just get me relaxed, go to sleep well. Believe me, your nervous system is not going to get crazy. It's going to be nice, and it's going to be good for you. But it's the way we do things.
I couldn't agree more with everything you're saying. But see, like someone like me, like if I say like, if I abstain from, you know, that, I kind of relapse. You know, I'll go like, well, I'll drink a little bit. And then every 2 or 3 months, I'll just drink a lot. You know, I think my personality is kind of like that. I know that about myself. So I've had to do the work to develop the positive coping mechanisms instead of, you know, so like I work out a lot. I eat really clean. But it's a struggle, you know. Every day I do want to go out there and go to the bar and drink, or I do want to smoke a cigarette, you know. But at a certain point in everyone's life, I think they realize that things have got to change. You know, if you want to feel a certain way, you want to live a certain way. There's things that you gotta do.
That's the point that medicine do and the ceremony. To you don't feel the necessity anymore. Like she's saying, I smell and I say, oh no. That's the same thing. I go to the bar or you go once a year and no, thank you. I don't feel the necessity. That's the healing. Yes.
I like that. That's a good point. Go
deeper.
So this is essentially a positive environment, a positive coping mechanism that you're offering the community.
Yes.
Instead of you having the ansias or having the anxiety, you can use that in a positive environment here. Get it out of your system, kind of.
Yes.
Right.
I have patients say, Yuri, if I knew how different I'm gonna think about meat, about pork, about alcohol, I will think twice because I don't enjoy anymore. Like I'm telling you, I don't feel the necessity anymore. And all my friends are still doing carne asadas, tacos, beer. And they say, and I don't feel that anymore. Like now I'm going. The question is here, this community, these new tribes, with her, with me, with people like us, that we can make so much more things without not the environment.
Right.
It's different kind, and focus on yourself. What
love
is
that.
your gift? Now we're gonna empower ourselves. Once you release the trauma, I still working with my patients, and so the next ceremony, we're gonna empower ourselves with our ancestors, with your DNA, with your numbers, to know yourself, your animal, your element, everything. So then you become your higher self.
Who you were supposed to be,
Your higher self, right here.
Get more connected with your higher self.
Yes, sir.
Yeah. I mean, being on the antidepressants for 30 years, what I discovered when I came off of them was that I was functioning, but I was numb. I was literally numb.
That sounds like misery.
Actually, it was better than being in the depression, right? So it was an improvement.
I got you.
And I think that's the problem with America is we accept the improvement because it's better than not getting out of bed for 3 days, right? I can be numb and I can go and live my life, but am I living? No, I'm just functioning. And when I got off of the antidepressants with the help of psilocybin, now I feel, I live, I cry, I laugh, I have ups and downs, but I'm like living. I love feeling now.
Wow.
Because for 30 years, I didn't know that I was numb.
Wow.
I thought that was normal.
Comfortably
I just
numb.
thought that's what it was supposed to be.
You were comfortably numb.
Yeah, because I was functioning, right? Like, because I lived with this severe depression pretty much all my life. And so I was like, hey, I'm killing it. I'm working, I'm helping people, I'm doing all the things. But now I look back and I'm like, yeah, I was doing, but now I'm helping people. Before I was helping people. I mean, now it's a new level because I am more present with myself. I'm more connected. I am more in alignment and more in flow. It's a whole different, and sometimes I find myself more emotional? Yes, but I embrace it because man, I would much rather feel the emotions of my client and be crying with them than to just be numb going, yeah, that sucks for you. Like, that's not living to me. That's not connecting.
Well, no. So with that being said, I'd like to know a little bit more about how you got into this. What was there like a pivotal moment that you went through that got you kind of going into this psilocybin therapeutic type of profession?
So I had cancer.
Wow.
I had non-Hodgkin's lymphoma.
Wow.
And it was a very aggressive form of cancer.
Stage 4, stage 3.
It was so lymphoma is a little different in that it's parts of the body. So I think it was stage 1. They caught it really fast. It was from a colonoscopy.
You got lucky.
I got very lucky. It was a routine colonoscopy that I would put off for years.
Yeah. Nobody wants to do a colonoscopy.
I didn't. And boy, I've had my fair share since because when you had cancer,
well, you got to.
You have to, right?
Yep.
And I went through some severe chemotherapy, the kind where
really?
I had to go into the hospital on Monday and have chemotherapy until
they were doing the drip
Friday to Saturday. Yeah, like 5 days straight, 5 bags. It was a lot. And today I probably would have done it different.
They were frying you out.
They were because I didn't understand there was alternative methods. But
nobody does.
Right. But it worked. It killed the cancer. But here's what I discovered when I was going through the process. There was a lot of people that were really facing a lot of fears, anger, shame, guilt.
In this cancer center?
In the cancer patients,
Okay.
And
Of course, right.
Oh, right? Like, especially guilt and shame if it's like lung cancer.
Cancer.
Right?
Shame.
Or things that are associated with smoking or drinking or... But it made me really, do more research and go, wow, what is, this is a whole area that I was not exposed to before. And I came across Johns Hopkins research that was for terminal cancer patients using psilocybin.
Wow. Oh, I've heard about that. Yeah.
And that's actually one of the first studies that changed the game.
That's like the main thing it got known for, right?
Yes, because what they came out with was it increased the well-being of people very much. Like I think it was 80%.
Accepting death, basically. Right?
Yes. And quality of life, just being able to live out their final years with happiness and joy instead of bitterness and anger, right?
Wow.
Bring your family members close when you're dying instead of shunning them because you don't want
You're
them
ashamed or whatever.
right?
Yep.
Which then leaves them with more suffering and pain because, right? So
and then they get guilt and regret and
all
all
that
Yes.
stuff.
Yep.
So when I started to research that and I started learning about this, because I was already doing trauma-informed work and I had already developed my own method on helping people resolve trauma, which is why I think I went into cancer with very little fear, anger, guilt, and shame. I'd already done a lot of work.
You're just getting it done. You want to get in there and just get it done.
Yeah, but then I started looking around me and going, wow. And so then I learned about psychedelics because I had a lot of time on my hands, a lot of time to do research, right? Because I'm sitting in a hospital room for days.
Doing chemo, yeah.
Yeah. So I started hearing about this and I thought, and then knowing that I had depression, been on these antidepressants all of my life, pretty much once I was done with the chemo, I was working with a physical trainer who had access to mushrooms. And I was like,
Cool.
yeah, maybe this is something I need to explore. And so that began my relationship with medicine.
What a powerful story.
Yeah.
And so Yuri, you had a very similar story too, right? I mean, so it's like Western medicine had kind of shoved both of you into this world, huh?
Because it's the most common outside. The most of the people is in the system, making this, taking the money and then give you asleep and then just control yourself. Yep. But it's part of the life. And in the end, we learn about we are humans. And we come in here to learn how to live as a human, connecting with the nature, and live in joy, laugh, and living in
not
presence.
Being numb.
Yes, living in presence. So even if you, like I say, it's different levels of traumas. We never know what our brother and sister is being through, So even if somebody microdose any kind of medicine, instead do this drugs for real, I mean, you have halfway through. So always recommend something natural with the people they know how to do things, because that's another point that I want to talk about is some facilitators in the city are facilitating different kind of medicines without knowing the right way.
That's dangerous.
It's dangerous, man. And it's in here in Las Cruces. So when I start coming with this idea I seen it and I start getting like, I'm getting a ceremony over there somewhere, and I was looking and it's not the right persons. And the right way, with respect, with intentions, with the preparation, the diet, and the integration. That is the whole package. Even if we do in different ways, we agree, absolutely. And it has to be a big package of a process and integrate the information.
That's exactly why I created the documentary, is because, so I have a documentary that it's called,
what's it called? Go ahead.
Yeah, it's called Unstuck. You can go to unstuckdoc.com and there's a trailer there. And right now it's being shown, it was shown in Albuquerque, it's going to be shown in Santa Fe, and then hopefully here in Cruces in March. That's my goal. But the whole reason for the documentary was to show people the process. Like, I can't tell you how many people call me. They don't even know what to ask me. They don't even know. Like, I'm like, well, what questions do you have? I don't know. I don't even know what it is. I don't even know. Like, they don't know what to ask. They don't know. Just say.
That's sad.
Right? Mm-hmm. They don't even know to go, like, what integration? That's a thing? They don't even know what to ask. And so this is why I have a cameraman. She's the director of cinematography. It's basically just her and I. I do the work. She just filmed it. But I wanted to show, what does it look like all the way from the start to the finish, so that there's something out there that people can go, oh, now I know what it's going to be and what it's going to kind of look like, at least the clinical way, right? Mm-hmm. And so that was really important to me, is to educate people on what it is, what it looks like, And that will alleviate a lot of people's anxiety around it.
Right.
Yeah.
Right?
Oh, 100%.
Yeah.
It's just a new way of healing and a new way of thinking. For me, I'm very familiar with it because I knew very young that the Western medicine was probably not the best thing for me.
Right.
So my whole life is based around alternative medicines now. That's just who I am. But yeah, I can easily see how people can be very confused and not understand, and it's overwhelming, really.
Yeah.
So it's good that you girls are out here actually educating people on this and offering this type of service.
Yeah.
So we're coming up here on the last few minutes of the podcast of the hour. Yuri, really quick, I wanted to ask you, if they did come here, how would the process be if they wanted to get involved with this type of therapy in your way? And then Catherine, I'll ask you the same thing as well. But say someone, hey, I want to do this psilocybin thing with Valley Care Wellness. How would that process look like?
Yes, it was pretty similar what she was mentioned before. First, we're gonna meet together, a few times, probably twice at least, to talk with the person and see if he is able to, and is ready for that the process, because it's not for everybody. Like I said, it has a bipolar or a blood pressure, whatever. It has some complications. I prefer go soft and without medicine. So therapy with the power of the word, good habits, changing some diet and getting some organic juice, first trying to raise the vibration of these patients to making it ready. So sometimes it's fast because the people already comes an emergency, hey, help me, please.
I bet you deal with that a lot too, yeah.
So we help them when there's that case, and we will see if it's for psilocybin or if it's for ayahuasca, or could be bufo. Bufo is really good for the heart addictions. It's really DMT, but the natural way comes from the frog. So there's the reset for real. And you, like I say, it's different ways. You don't have to microdose. You can just go straight with the bufo and then see how your body respond. And you can microdose a few times, and then probably another ceremony and another medicine. We have not only that one, we have a different ones. Cambo is another one. I want to say the shot or the vaccine from the jungle. You really, a lot of people does Cambo once a year or twice a year, and you really have your immune system is so high that no matter what's happening outside, everybody gets sick, everybody gets getting around, and you are untouchable, because of course this vaccine from the jungle are so strong. Your body got really, really a high immune system. So and they just keep the frequency and the guide and the people, but it's first to meet them and to see how we're gonna work with each one. But it's totally different every time, man.
So many different ways to get help here, guys, here at Valley Care Wellness. I mean, it could be just as simple as just changing your diet, getting you some high frequency organic juices and some lifestyle changes with some coaching, or it can go as intricate as these different types of natural medicine modalities. Either way, Yuri here has your back, and she's got all the positive intentions to help you heal here. She's not here to take advantage of you, to hurt you at all. She's actually a very loving person, and she's doing this with the right intentions. I truly believe that, and I respect her greatly for it. So thank you for sharing that with us. If anybody's interested, feel free to reach out. Yuri's always here. She's very available, and this is what she does. And so Catherine, same question to you.
Yeah, I actually first also like to say about Yuri, there's also breath work. Breath work is a big, it's a very valuable technique that has given me experiences that I can't say it matches psilocybin, but the messages and the meanings have been just as big as psilocybin. So for people who maybe are contraindicated towards the medicine, Yuri does offer breath work. So
good point.
Yeah, I want to make sure that I announce that, because if people aren't interested in the medicine but still want the connection with self, the connection with the altered consciousness.
That's right.
There's other ways to
Fantastic
do that.
point. Breath work is huge.
Yeah, breath work is huge. Yeah.
That's right.
So then the question that was posed to me is,
someone wants to come to you and they're like, hey,
probably
you kind of already answered it, but let's just kind of go over it again.
I just, there's an assessment, there's this whole process. I schedule them as I have enough people.
Does insurance you take insurance?
Oh no,
I didn't think so. Yeah.
At the end of this year, though, that will be a thing. That's
Okay.
what's so amazing about what New Mexico's doing.
Yes.
They are going to make this to be accepted by insurance.
I'd rather that funding go to what you're doing and a lot of other stuff they're putting funding in.
Yeah. Something else I also wanted to just mention before we end. I also have a book that's coming out next month.
Cool.
It's called Trip the Light Within. You can
Cool.
go to tripthelightwithin.com.
Cool names on everything you're doing, by the way.
I know, right? Well, here's the thing I want to say about that. I wrote the book, but I'm not sure I wrote the book.
You're prolific. That's cool.
I think mushrooms wrote the book.
Yes.
Because there's so many times. So mushrooms mushrooms told me to write the book. This was not my own idea. In fact, I talk about it in the book, how mushrooms literally scanned my body and forced me and said, you're writing a book, whether you like it or not, it's happening.
I like it. I like it.
I wrote the book, but I feel like I channeled the book because I got into this flow when I was
that's
writing
better.
it.
That sounds better.
Oh, amazing. But the book is about my journey and also not just personally, but professionally. And the whole point, again, is to educate and advocate for this medicine.
Okay.
So, and that book is going to be out, like I said, in March. I'm hoping here in Cruces, I can tie it up with the screening of my documentary.
Well, let us know. We'd love to help out with that.
Yeah. So that should be a thing. I'm really excited, again, because it's about education. I want people to have something that they can read that's going to make them feel a little bit more comfortable with the medicine. Ultimately, it is a personal relationship with the medicine. So,
That's wonderful.
Amazing.
That is wonderful. So amazing things going on here in Las Cruces. We have all kinds of natural healing going on. We got organic juices. We got books being written to help walk you into this. We got websites. We got documentaries. We're just here for you here, Las Cruces. We're here for you. We're all here that are engaging in natural healing. We love it. We've all been betrayed by Western medicine in some way. That's what kind of got us here. So we're right there with you guys. You're not alone. Okay, you guys got a team here that's willing to help you in so many different ways. It's all love. Thank you so much, Las Cruces, for listening. Thank you so much, Yuri, for having this wonderful podcast here and having our wonderful guest here, Catherine Warnock.
Yeah, sorry.
Catherine Warnock. Wonderful person. It's been a pleasure meeting you, ma'am. And we'll be seeing you again soon, hopefully in the near future.
Yeah.
All right.
Yeah.
That's
We're in touch.
it for the third podcast of Yuri's podcast, Valley Care Awareness. Thank you guys so much again. We'll catch you guys next time.
Thank you.